Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now, there's a couple things going on today with you. Now we've got, well, the main chief complaint is going to be that low back pain, and then you're saying low back pain and hip pain, but you're having more issues with the left side of the hip.
Yeah.
Now, these are times where even when you're laying down, like just like in your bed, you can't lay in certain positions because of the pain. Okay, and this has been going on for how long now?
It's been going on for about 5 years or so.
Okay, so about 5 years. Now, there are certain positions that you can lay in, some that you can't. But yeah, now this is all primarily all down here, correct?
Yeah.
Okay. Yep, and I know you were saying you felt like the curve in your low back, like it just didn't feel right.
Yeah, it's more indented towards my body rather than more straighter.
Okay.
More natural.
Okay. And then the secondary complaints that were going on have been, it was a little bit more right-sided in between the shoulder blades, and then you're feeling issues kind of going in that upper back, and then also up in the neck, right at that base of the skull right there, correct?
Yeah.
So right around the occiput, so she's having some issues in here. Now, it's not, as you would describe, it's not a headache like that you get, but it's just kind of like...
Yeah, it's just concentrated in the back.
Okay, so it's just like right here. How often is that?
Around 2 times a week.
Okay, so about 2 times a week. I mean, and this has been going on for years as well? Okay, let's go ahead. I'm going to have you stand up. Let's get a baseline just where you're at. So we're going to go through upper and lower. So I'm going to have you look all the way up at the ceiling for me. Any pain, tenderness, tightness, pulling, anything like that?
Just slight tightness at the base of my neck.
Okay, I'll have you look all the way down at the floor. Any issues with that?
The very bottom of my neck.
Okay.
Is hurting.
In the middle? Okay, and then bring one ear to one shoulder. Any issue there? And then to the other side. Any issue with that?
Yeah, a little bit of pulling.
Okay, and then if you rotate over either side, any issues with that?
Not really, no.
Okay, next what I want you to do, I want you to bend forward at the waist for me. Any pain, tenderness, tightness, pulling, anything like that in the low back?
Just a little bit of pulling at the base of my spine.
Okay, in here? Now does that, you can stand up straight, is that pain, does it stay there? Do you notice it going into the legs?
It just stays there. It kind of goes down a little bit lower into my hips, but it's not going completely into my legs.
Okay, now if you extend back like this, any issues with that?
Yeah.
Where do you feel that at?
The same spot.
Okay, is it more on that left side when you do that, or?
It's in the middle.
It's in the middle.
Straight middle.
Okay, and then is that staying there, or does that go down as well?
That goes down. That goes down.
Okay, where does it go into the legs when you do that?
It goes around to my knees.
Okay, does it cross the knee or no?
No.
Okay, so you feel pain going down and it comes into like the front. Alright, if you were to lean into one side like that, any issues there?
My left hip is hurting a lot.
Okay, and then do the other side for me.
Not an issue.
Okay, and then if you rotate, any issues with that?
Yeah, my right shoulder blade hurt both times.
Okay, and that was that, like right in through here,
Yeah.
where you had that other complaint on? Okay. What I'm going to have you do, I'll have you take your glasses off right now. So put them over right there. And I'm going to have you lay face down on the table for me. Okay. So I'll have you bring your arms, yep, right there. So what we're going to do, we're going to scan the entire body. We're going to go from that cervical spine all the way down to the leg length. And then we're going to check the symmetry from the right side of the body, comparing it to the left. Let me know if anything is tender to the touch. I'm just going to palpate and push in on the spine and the surrounding muscles here. So I start in that cervical spine.
Yeah, that hurts.
Okay, so she's feeling a little bit of pain in that cervical spine. We're going to go through the thoracic spine. Any issues with this?
Yeah, just
Because
tightness.
I feel you kind of squeezing in, like I'm hurting you here a little bit. Let me know anything, if anything is uncomfortable, okay? Alright, now we're going down into that lumbar spine. Sore in here?
Yeah.
Okay. Any issue over that right SI joint?
Not really, no.
Anything directly over the sacrum?
Just slightly.
Okay, and then what about that left SI joint?
Yep.
Yep, okay. Let's come down here. We're going to check the leg length out. So almost balanced, almost perfectly balanced. If you're to say anything, pulls a little tiny bit short on that right side. When we scan up, hips are looking balanced from this position. Actually, things are looking balanced with looking up. What we're going to do, we're going to start off with the massage device, and we just want to relax everything first. How did that feel?
It felt really nice.
Okay, good. Yeah, I just had to get it to the right setting for you. But okay, so as you guys know, I always like to start the adjustments in that cervical thoracic junction here. Okay. Yeah, we're going to start with that T3 on her left side here. There we go. I'm going to drop down to a T2 on the right. Good. Okay. So I'm going to have you take a deep breath in and exhale out. One more time, deep breath in and exhale out. There we go. Let's come back down here, recheck that leg length. Already looking better. Almost, if we were to really say, almost pulling a tiny bit short on the left side, but already looking good. Now granted, her leg length differential was not that severe at all anyways. Okay, so we're going to go down to here. Let's stabilize on the sacrum. I want you to raise that right leg up as high as you can for me. Any pain, tenderness, tightness with that?
Just a little bit.
Okay, relax that side. Raise the left side for me. How does the left side feel compared to the right?
It's more stiff. I'm having more trouble raising it.
Okay. So what I want you to do, I want you to cross the left foot over the right foot. Good. The table is going to come up from below you. Good. So what we're going to do, we're going to do a P to A drop, meaning from posterior to anterior. And what we're also going to be doing is we're going to be putting a clockwise torque in to bring that sacrum back to midline here. There we go. Uncross and bend just this knee. Yep. I got you. Relax it. Let's do one more here. There we go. Hand down. Okay. We're going to stabilize again right here. Raise the left side up for me. Do you notice a difference?
Yeah, it's much easier to lift it.
Okay, good. So she's already noticing it easier to lift just with that. Come to the leg length, recheck, completely balanced. Let me go through the lumbar spine though. I'm going to push in. Let me know if you feel any tenderness, any pain, anything like that.
Right about there.
Okay. And we're going to do the left side as well.
Okay, it starts right there.
Starts right there?
Mm-hmm.
Okay. I'm going to have you first lay on your side, facing me.
Okay.
Let me bring this up. I'm going to have you bend this leg, bring it up, good. There we go. Flip to the other side. Watch here. Oh, good, that doesn't catch your necklace. Good. There it was. Flat on your back for me. Okay. So from here, we're going to do the leg pull. With the leg pull, you'll feel some release in the ankles, the knees, going up to the hips. Just relax and let me have your leg. Relax, relax, relax. There we go. Now we're going to have you stand up. Come all the way up for me. And we'll have you stand right here. Good. Alright, we're going to have you bring your arms out by your side. We're gonna do that standing intercostal. So I'll have you put your hands up and over mine. Yep. Lean back onto me. Squeeze your elbows together. There you go. That moved really well for you. And then I'll have you take a seat right here, facing that way. Okay. We're going to do that anterior thoracic adjustment here. Yep, it's coming around there. Okay. Bring one arm up and over. That other up and over. Okay. So I want you to take a deep breath in and exhale out for me. Oh, there it was. Relax right there. I'll have you scoot down just a little bit. Perfect. So now we're going to do the wide strap. This is where you're going to get that decompression from all the way up top, going all the way down. So I'll just need you to help get your hair through for me. Perfect. And relax. Let your hands rest on your stomach. Perfect. And just breathe, make sure and breathe. There we go. Deep breath in, and breathe out. Do that 2 more times for me. There we go. How are you feeling?
Better. I'm a little bit shaken from the wide strap.
It's a powerful move, isn't it?
It is.
I know people see the videos, and I'm going to ask you the same question I ask every patient. How would you describe that to someone who's never had that done?
I kind of felt all of my vertebrae kind of individually moving, but there's no tension in the shoulders, and I feel like super relaxed right now.
Good. This is how you should be feeling, after you get an adjustment. Feel relaxed, a little bit at ease. How are you feeling?
Good.
I'll have you stand up. Kind of move around, look up, look down again. Do you notice a difference from when you first came in?
The shoulder pain is just completely gone right now, the shoulder blade.
Okay.
And I feel very flexible around my hips.
How's the low back doing? Because I know that the left side of the low back and the hips were...
Yeah, it's better. It's better. I actually don't feel like it's caving in or anything.
Good. Good. Did you expect this type of result after one adjustment?
Not really, to be honest, but this is my first one, so I didn't know what to expect anyways.
Correct. But I know you guys are local, so which is a good thing. You guys have me here. It's not like you guys have to make a crazy long drive to get here, or flight, or one of the above. But yeah, so even just with that one adjustment, that's how patients need to feel. Like you were living with that low back, and you're living with that in between that shoulder blade on that right side. And it's like you became used to it. That was like for you, like your normal. Which, as you can tell, even just with that one adjustment, now you don't have to live with that shoulder issue, that low back issue. You're not feeling like it's caving in the low back. So, good. Happy?
Very. I'm just absolutely amazed right now. I haven't had this relief for a long time, so.
Good.
Thank you.
You're very welcome.